We turn now to a controversial medical disorder that some even consider to be a form of child abuse. It is called Munchausen syndrome by proxy. And not only is it difficult to identify, just an accusation can be enough to cause family conflict. When Julie Gregory thinks about her childhood, it's always the doctors that come to mind.
We had migraine headaches, we had sore throats, and then we had intestinal issues. I had to drink barium pills.
And always by her side, her mother, whose sole purpose seemed to be, as Julie remembers her saying, getting to the bottom of her daughter's sickness.
Sometimes I would wake up and she'd say, "You're sick, you're not going to school." Sometimes I would just get an announcement over the loudspeaker and the principal would say, "Julie Gregory, your mother is here to pick you up."
But no matter how many doctors she saw, Julie never felt any better. She says her mother became obsessed with the idea that Julie had a heart problem and even convinced a cardiologist to operate.
When I was 13, I was cut open for a heart catheterization. I did not know I was in the hospital for an actual surgery, and so when the nurse came in, I just freaked out. I blurted out that my mother was making me sick.
It's a charge Julie's mother strongly denies. She says she was only trying to help her daughter and that Julie made up stories of abuse as an adult to make money by publishing a book about her childhood. But Julie says it was only as an adult that she learned a name for what she says happened to her: Munchausen syndrome by proxy, a rare form of child abuse in which a parent, usually the mother, causes her own child to become sick to get attention for herself.
Munchausen by proxy is perhaps the single most lethal form of child abuse. These kids may undergo immense numbers of diagnostic tests, medical procedures, and medication trials with all the risks that go along with that.
Dr. Mark Feldman has studied Munchausen by proxy for 20 years. He says it's not as hard to trick a doctor as you might think.
We're taught that the single most important information is what the patient or the family tells us.
But some say Munchausen by proxy doesn't even exist. Groups like MAMA, Mothers Against Munchausen Allegations, say doctors make such accusations when they can't find the cause of a chronic illness or when they're just tired of what they may see as a troublesome mom.
Because of this whole witch hunt that's going on, then what they're actually doing is they're taking the babies away from the parents.
Dr. Feldman, who has testified both for and against parents accused of Munchausen by proxy, says, if anything, the real number of cases is far more than the number reported, in part because doctors who make an allegation risk their reputations.
The parents plead ignorance, the tears flow, they mobilize the media, and all that time, the doctor isn't really allowed to talk about the case.
For Julie Gregory, now a mother herself, there's no excuse for possibly leaving a child in harm's way.
I get letters all the time from physicians and caseworkers that really want to help a child. And I just do whatever I can to make sure people understand that every day that that child is with the perpetrator is a day that that child's in danger.
And Julie's mother has since moved to Montana, where she adopted 2 other children. Julie attempted to have them removed from her mother's care after her book was published. She was unsuccessful. And joining me now is Darren Strauss, author of a novel called More Than It Hurts You, which is basically about this issue that we're talking about, Munchausen by proxy. Good morning.
Hi. Yes.
Tell me about it's a novel, but you spent about a year, I think, researching this.
I did.
I don't even know what to call it. Ailment? Illness? Syndrome?
It's very strange.
It's controversial.
It is.
Are you sure, after a year of research, that it exists?
I believe it exists, yeah. I think it's very hard to diagnose. So I think that's why it's controversial. Anytime kids are involved, anything gets controversial.
You talked to a number of doctors, but I was intrigued to find out that you couldn't talk to any of the parents. You weren't able to get in touch with any, basically, patients, people who are accused of having this.
Well, people who are accused of poisoning their kids or harming their kids on purpose are not
They don't want to
very
talk.
excited to talk to people about it.
What do the doctors tell you, though?
The doctors tell me that it happens about 2,000 times. It was 2,000 times last year in America, it was reported, but they say it's underreported. That's like what your Dr. Feldman was talking about, because it's very hard to prove.
And doctors are wary of going there, right? I mean, would a doctor sooner just keep prescribing medicines and treating instead of going in this direction?
I think for a number of reasons. Doctors don't want to break up families, and just because it's not a kind thing to do, and also because it's very controversial, as you say, so they'll often get in trouble with the media or local authorities because families can go and complain to the media and the doctor will be unable to respond.
Does a parent who's doing this know that they're lying?
Oh, yes. Every case is different, but there are cases where someone will poison the child, do all sorts of awful things that they have to be conscious of doing, strangling the child, injecting the child with all sorts of vile substances. So yeah.
And it's often women. It's often mothers.
It's 90% of the time it's the mother. Yeah, I don't know why.
Nobody knows why.
It's a very hard disease to diagnose or to understand. I mean, who would harm their child to get attention? I mean, that's what the book is about. It's about the mystery of the disease and a family in trouble and how little you know your spouse. I mean, because you think, there's no way my spouse could do this, but what if your spouse was accused of doing something like this? How would you react?
Darren Strauss, fascinating stuff. Thank
Thanks.
you. Thank you for being here.
Thanks for having me.